roll number 99, and my partner is Pawar, roll number 100.
Hitler.
And we are presenting a seminar on a topic disorder related to the metabolism of sulfur-containing amino acids. From our previous knowledge, we already know cysteine and methionine are a sulfur-containing amino acid, in which cysteine is a non-essential amino acid and methionine is an essential amino acid. Next is the disorder of a sulfur-containing amino acid, in which we can see cystinuria, cystinosis, hypermethylaminemias, Osteoid syndromes, homocystinuria, and cystathiurias. For any kind of disorder, we will discuss about its causes, its diagnosis, and its treatment. Let's see the cystinosis. Cystinosis is an inherited disorder of amino acid transport, and it is the most common inborn error of amino acid transport. At genetic level, it is a autosomal recessive disorder and include Garrod inborn error of metabolism. Garrod are a group of disorders which include albinism, alkaptonuria, cystinuria, and pentosuria. Cystinuria mainly occur due to abnormal excretion of cysteine, and sometimes due to abnormal excretion of lysine and arginine also. This condition is known as cysteine lysinuria. Now see the clinical feature of cystinuria is the crystalluria, in which cysteine crystals are formed which are insoluble and precipitate and leads to formation of renal cysteine calculi, which may leads to obstructive uropathy and leads to renal insufficiency. Here you can see in the diagram cysteine stone in the urinary bladder. Now see the diagnosis of cystinosis. Cystinosis show positive cyanide nitroprusside test, and its diagnosis is also done by chromatographic technique. The treatment of cystinosis include large water intake so that dilute urine is excreted and it prevents from crystal formation. Solubility of cysteine is increased by alkalization of urine by using sodium bicarbonate. Now see the another disorder of sulfur-containing amino acid metabolism, which is cystinosis. Cystinosis is an autosomal recessive disorder, and it is characterized by accumulation of cysteine crystal inside the lysosome of cell. Once the protein chain amino acid is formed inside the cell, it needs to be transported outside the cell for its functioning. But due to defect in the transport of cysteine out of the cell, this leads to cysteine accumulation inside the cell. The major organ affected in cystinosis are liver, spleen, bone marrow, kidneys, cornea, lymph node. If you see in the blood at microscopic level, WBC show accumulation of a cysteine crystal. And the treatment of cystinosis include adequate fluid intake so that dilute urine is excreted and increased fluid output. Alkalization of urine using sodium bicarbonate, and also by the administration of a deep penicillamines. Now the further disorders are discussed by Hirkani.
Let us see hypermethionemia. Hypermethionemia is a metabolic condition categorized by abnormally high levels of methionine, an essential amino acid which form protein in the blood. Causes are impaired utilization, excessive remethylation of homocysteine, and secondary to hepatic dysfunctions. One syndrome related to this is Osteoid syndrome. It is a rare autosomal recessive metabolic disorder wherein malabsorption of amino acid methionine in gut takes place. Excretion of methionine, branch-chain amino acids, aromatic amino acids, and alpha-hydroxybutyric acid in urine. This alpha-hydroxybutyric acid in urine causes this unique odor, Osteoid odor. Homocystinuria. It is autosomal recessive condition. Normal homocysteine levels in blood is 5 to 15 micromole per liter. But in this disease, it may be increased 50 to 100 times. Causes of homocystinuria are cystathionine beta synthase deficiency, deficiency of N5 and 10 methylene THLP reductase, vitamin B12 deficiency, and deficiency of methyl B12. Here we can see Here we can see the pathway of conversion of methionine to homocysteine and homocysteine to cystathionine and cystathionine to cysteine and alpha-ketobutyrate. As we discussed earlier, the deficiency of enzyme N5 and 10 methylene THF reductase will impair the conversion of N5 and 10 methylene THF to N5 methyl THF, which will impair the vitamin B12 conversions and will impair the methionine conversion to cystathionine. So indirectly it is leading to accumulation of homocysteine in the blood. Similarly, deficiency of vitamin B12 will cause the same causes. Now here, cystathionine beta synthetase is responsible for conversion of homocysteine into cystathionine. When this enzyme is deficient, this reaction is impaired and homocysteine will go on accumulating in blood, causing this disorder. Diagnosis of this disorder. Citrate hydrochloride test positive. Specific amino acid urea, chromatographic estimation of cystathionine synthase activity. Now treatment for this disorder is pyridoxine vitamin B6 activates cystathionine synthase which will help conversion of homocysteines into cystathionines. Diet low in methionine and supplemented with cysteine. Vitamin B12 in vitamin B12 deficiency. Cystathionine autosomal recessive deficiency of enzyme cystathionase. Historically, it is linked to mental retardation, anemia, thrombocytopenia, and endocrinopathies. Can be acquired through pyridoxine, that is vitamin B6 deficiency, liver diseases, or thyroxine administrations. Mild forms appear with disrupted homocysteine remethylation, vitamin B12 deficiency, or impaired folate metabolism. Diagnostic tests are confirmed by detecting cystathionine in urine. The cyanide nitrochloride test is negative. Now, medical treatment for this disorder is high doses of pyridoxine, that is 200 to 400 mg, are often highly beneficial. Thank you.